Continental Europe is preparing for a third wave of coronavirus amid a surge in new cases and a shortage of vaccines that can reduce the spread of the disease. Large parts of France are going into lockdown again tonight amid a sharp rise in cases. Only 8% of the population has been vaccinated. Switzerland is extending its restrictions. Poland, where the surge is being driven by the variant from southern England, is going into partial lockdown. The German Chancellor Angela Merkel has today said it's now probable that restrictions will have to be reimposed too in Germany. The vaccine rollout across the EU has been slow, with around 10% of the population vaccinated so far. Confidence has been shaken after more than a dozen EU countries suspended the rollout of AstraZeneca over concerns about blood clots. The rollout is being resumed in several countries, but not yet all. Here's our Paris correspondent, Lucy Williamson.
Never mind the Prime Minister. In France, it was the AstraZeneca jab that needed a shot in the arm today. After weeks of shifting guidelines, the message was meant to be clear. It's safe and it works. But only an hour before he received it, France's health authorities said a possible link to blood clots in younger patients meant the jab should only be used for those over 55. Last month it said only those under 65 should take it. Lucky for Mr. Castex that he turned 55 last year. But only 20% of French surveyed this month said they trusted the AstraZeneca jab. As President Macron held off announcing a new lockdown, cases spiralled, and Paris hospitals are now scrambling to find space for patients who need intensive care. A lockdown light has been imposed on the worst affected areas from tomorrow.
It's not because it's nice out, because it's spring, that we put our lives in danger. It's not over. We're still facing the variants, and people should realize the gravity of the disease.
Across the border in Germany, Angela Merkel said she too would have the AstraZeneca jab. Germany had been hoping to lift some of its restrictions next week, but with infections soaring there, a warning from the health minister. Public opinion is only half the problem.
There are not yet enough vaccines in Europe to stop the third wave through vaccination alone. Even if deliveries of EU orders are now reliable, it will still take several weeks before the risk groups are fully vaccinated. Only then can we talk about wider openings in society.
Poland is also facing a surge in cases, with the British variant expected to account soon for 80% of infections. A partial lockdown will come into force there from tomorrow. Shops, hotels and cultural and sporting venues will close. There's acceptance breaking across Europe that it's facing a third wave in this pandemic. Hope that the vaccines might outpace the virus has been crushed by a grinding lack of momentum, supply and public trust. As Europe prepares for more restrictions, criticisms are mounting along with costs. Empty streets can help save patients, but delays in vaccines are expensive and politicians could still pay the price. Lucy Williamson, BBC News, Paris.